Welcome to the art of vitamin B12, an art of the body's essential vitamin. Vitamin B12 is a nutrient that helps keep your body's blood and nerve cells healthy, helps make DNA, and also helps prevent megaloblastic anemia, a blood condition that makes people tired and weak. From what sources can we get vitamin B12? You can get recommended amounts of vitamin B12 by eating a variety of foods, such as clams and oysters, fish, meat, poultry, and eggs, milk, and other dairy products. Some breakfast cereals, nutritional yeasts, and other food products are fortified with vitamin B12. You can also find vitamin B12 in the form of supplement, such as cyanocobalamin, adenosylcobalamin, methylcobalamin, hydroxycobalamin, and the sublingual form, a vitamin that dissolves under your tongue. Are you asking about recommended intake? Average daily intake is differentiated by age. From birth to 6 months are 0.4 micrograms. From 7 to 12 months are 0.5 micrograms. From 1 to 3 years are 0.9 micrograms. From 4 to 8 years are 1.2 micrograms. From 9 to 13 years are 1.8 micrograms. From 14 years to adults are 2.4 micrograms. For pregnant teens and women are 2.6 micrograms. And for breastfeeding teens and women are 2.8 micrograms. Your body stores 1,000 to 2,000 times as much vitamin B12 as you typically eat in a day, so the symptoms of vitamin B12 deficiency can take several years to appear. If you have a vitamin B12 deficiency, you may feel tired or weak. These are symptoms of megaloblastic anemia, which is a hallmark of vitamin B12 deficiency. You might also have pale skin, heart palpitations, loss of appetite, weight loss, and infertility. Your hands and feet might become numb or tingly, a sign of nerve problems. Other symptoms of vitamin B12 deficiency include problems with balance, depression, confusion, dementia, poor memory, and soreness of the mouth or tongue. Are you one of the following group at risk of vitamin B12 inadequacy? Let's find out together. Depending on the definition used, between 3 and 43% of community-dwelling older adults, especially those with atrophic gastritis, have vitamin B12 deficiency based on serum vitamin B12 levels. Atrophic gastritis decreases production of intrinsic factor and secretion of hydrochloric acid in the stomach and thus decreases absorption of vitamin B12. Another condition associated with vitamin B12 deficiency in older adults is Helicobacter pylori infection, possibly because this bacterium causes inflammation that leads to malabsorption of vitamin B12 from food. Individuals with stomach and small intestine disorders, such as celiac disease and Crohn's disease, may be unable to absorb enough vitamin B12 from food to maintain healthy body stores. Pernicious anemia is an irreversible autoimmune disease that affects the gastric mucosa and results in gastric atrophy. This disease leads to attacks on parietal cells in the stomach, resulting in failure to produce intrinsic factor and malabsorption of dietary vitamin B12. Surgical procedures in the gastrointestinal tract, such as for weight loss or to remove all or part of the stomach, can cause a complete or partial loss of cells that secrete hydrochloric acid and cells that secrete intrinsic factor. Thus, these procedures reduce the amount of vitamin B12, particularly food-bound vitamin B12, that the body absorbs. Vegans who consume no animal products and vegetarians who consume some animal products but not meat have a higher risk of developing vitamin B12 deficiency because natural food sources of vitamin B12 are limited to animal foods. Exclusively breastfed infants of women who consume no animal products might have very limited reserves of vitamin B12 and can develop vitamin B12 deficiency, sometimes very early in life. The reasons include the small amounts of vitamin B12 in the breast milk of vegan mothers, as well as the limited amounts of vitamin B12 crossing the placenta in these women during fetal development. Now, let's talk about vitamin B12 might be involved on some diseases. Vitamin B12 and other B vitamins are involved in homocysteine metabolism, and researchers have hypothesized that supplementation with these micronutrients can reduce CVD risk by lowering homocysteine levels. Thank you, and see you next time.